everybody. Thank you for joining me. You're at home with Melissa, and I'd like to take this opportunity to give you some current information and statistics on the novel coronavirus coming out of Wuhan, China, that originated there. Okay, all of this information is the most current I could gather as of, I know, I have a co-host. Sorry. Anyway, it's the most current, up-to-date that I could gather from these sources as of 3 o'clock p.m. Eastern Standard Time today. I'm going to be reading a lot of the information because, in fact, most of it, because I do want to get everything correct. And following the statistics, I'll give you some updated news information I've come across, okay? And again, thank you for being here. I really do appreciate it. Okay, the most recent numbers updated as of today coming out of the ECDC in regard to the coronavirus is that we've had a total of 6,072 cases worldwide with 132 deaths, and the people who passed away were all from China. We're all in China. And China's total number of cases reported, confirmed as of this time, are 5,994. Then the remainders that we have are as follows: 14 confirmed cases in Thailand, 8 in the Republic of Korea and Taiwan, 7 in Japan, Singapore, and Malaysia, 5 in Australia and the USA, 4 in both France and Germany, 3 in Canada, 2 in Vietnam, and 1 in Nepal, Sri Lanka, Cambodia, and the United Arab Emirates. Then we also have here a list that I've gathered of suspected cases reported, and that's from a different source, and I'll give that to you later in this video. First, I want to cover a few news items that I've come across. It has been stated by some on a news report I saw that researchers hope for a vaccine by this summer. I've also heard it stated that I think it was the Chinese hope to have a vaccine within about 3 months. Now, I doubt that's likely. I think that I think it was Australia maybe who just as of yesterday or today had created the virus, had recreated it. So the odds of being able to come up with and test a vaccine in that short amount of time of a few months is highly unlikely. In fact, hoping for a vaccine by this summer, I've heard from other professionals, is really hoping for the best. So we don't know where that stands, but in terms of the amount of time, but we know it's not going to be really soon. The Chinese have also stated that they thought that the infection, the epidemic, would peak within 10 days, and everywhere else I've heard, they say, no. Plus, I mean, if you just look at it logically, we have discovered that it can be passed person to person during the incubation period when they're asymptomatic, and you wouldn't be able to catch those people and keep them from spreading it further if you don't know they exist, if you don't know that they're infected. So I don't see how that could be predicted, but all the professionals that I've heard and the medical people have said that no, they don't. No. I mean, it's still on the rise. We have a lot of cases still being identified, suspected cases, etc. No, it's not going to peak in 10 days. They expect it's going to be around for a little while yet, at least. Okay, so the number of cases in China doubled from the previous 24 hours yesterday. And we've had an increase of more than 1,000 from yesterday to today of the reported cases. And they're saying that, and these are both important things to know, it is less deadly than SARS, but it's more infectious, which means that in SARS, I think 10% of the people or something like that, maybe not, but there was a much higher percentage of the people who contracted it and then ended up passing away. So this is more mild. However, it's still a lot stronger than your average virus in terms of mortality. And it's more infectious than SARS or MRSA. And their concern is, of course, that as we go through the epidemic, possibly eventually becoming a pandemic, that it'll mutate and become something more deadly, more lethal. And the World Health Organization increased the risk from the coronavirus from moderate to high, and they declined yet to declare it an emergency worldwide. They said no, which makes sense. I mean, if you look at this point in time, we have isolated cases occurring outside of China. And so, I mean, 6,072 cases total, 5,994 of those occurring in China. So at this point, there really aren't that many cases in the rest of the world, all combined. And so they say that at this point in time, they see no reason to declare it as a global emergency. However, it is an emergency within China itself, obviously. And of course, we now know that there is possible person-to-person transmission during the period that you're incubating the disease when you're asymptomatic. And it's reported by the BBC News health editor Hugh Pym that, and I've heard it reported elsewhere as well, that one German man apparently caught it from a colleague who had come in from Singapore, I think, and who was asymptomatic. And a Japan bus driver had been driving some people from Wuhan around, and then one of these people spread it while asymptomatic at the time they transmitted it. And the German, I hope I'm getting this right because my notes there were a bit odd, but I think I am. The German guy caught the virus from an asymptomatic colleague who had come over from Singapore. Then the bus driver was driving around people from Wuhan and contracted the virus as well, although these folks were asymptomatic too, is the way that I understand the story to have been. Then yesterday, out of ANC News in the Philippines, Dr. Susan Mercado, public health expert and special envoy for Global Health Initiative, said that from the time, she gave some of the timelines for the progression of the disease. And what she said is that from the time you get it, it incubates for 5 to 7 days, and that's when you get the first symptoms. Now, the first symptoms are difficult to tell from a lot of other viruses because they're just a cough, fever, some body aches, things like that. So those are your first symptoms at 5 to 7 days after contracting the illness. And about a week later, which is at about the 14-day period, if you're infected, you'll begin to experience a lot of difficulty breathing. You might even go to the hospital because you're going to be having a lot of trouble breathing. 3 to 4 days later is when these symptoms, the difficulty breathing, would become so severe that someone would have to be admitted into intensive care. And as we discussed before, I think, but you may have already heard this, the problem is that your lungs can fill with fluid and you can die of respiratory arrest. Your kidneys can shut down, things like that. So these are the people that would pass away from it. The percentage of people who contract it don't get that severe case. Only, I think it's 2.6 to 3% of people who contract it will end up dying from it. So as far as we know right now, it's not all that lethal. And as per Dr. Susan Mercado, it can be up to 20 days that you might have it total, and that you might have it and be able to spread it around. And then the Ministry of Public Health in Ecuador says that they have one suspected case. And then as per pharmaceutical technology, they're at 11 a.m. Eastern Standard Time today. Suspected cases in other parts of the world include one in Kenya and the Ivory Coast, 4 in Ethiopia, 27 in the Philippines, 1 in Colombia, 8 in Indonesia, and 670 in India. But remember, India has a huge population, but those are the suspected cases. Then I was speaking, and this is just, a little bit of extra information. It's not a stat or anything like that. I was speaking this morning with a nurse practitioner at my local hospital about what the hospital staff think about the novel coronavirus and how things are going to go overall. And he said to me that they've been discussing it and that they really think that when it's all said and done, this is not going to be something that rivals the 1918 Spanish flu epidemic, that it's going to be, in fact, less deadly overall, having killed fewer people than the average influenza does in a given year. So, as he pointed out to me, we currently have at my small local hospital about 10 cases per day of people going into hospital with influenza. And so if you compare the numbers, there's quite a difference there. And that's a lot. And we have thousands of people just in this country who die of the flu every year, or at least more than 1,000. But I think it's thousands. And so I should have checked that before I said it, but I'm just going off the cuff now, and so I didn't, because I didn't know that was going to come out of my mouth. But we have a lot of people who pass away every year as a result of your typical seasonal flu. And we've had no cases outside of China of anyone dying from this yet. In my tiny community, we have 10 people hospitalized because of the flu daily. So they really, at the hospital, as they talk about it, they don't think that this is going to get that bad. But as he said, they don't know. They're just guessing. Their opinion is, as medical professionals on the whole, is that they don't think it's going to be even as bad as the flu. So, however, keep in mind that it's more deadly than the flu. If you get it, you're more likely to pass away than the flu. But what they're saying is overall numbers. They don't think it's going to come anywhere near rivaling just your average flu. And so, that, while it's very sad for anybody who contracts any of these illnesses, it probably gives a lot of people some comfort to think that In fact, it's not just here in my town, but a lot of professionals say that they don't think this is going to become a huge pandemic. Others, of course, say the opposite. And so, take it with a grain of salt. The only thing that you can really count on to any degree, and of course that's as near as we have information for, is the numbers right now. How many people are suspected, how many cases are active and diagnosed, confirmed. That's the only thing you can be really sure of in terms of numbers. The future still remains a bit unknown, a bit cloudy. Different people suspect it's going to progress in different ways. Keep in mind that unprecedented lengths are being gone to by different governments around the world in trying to prevent the spread of this. So, you've got China alone, the largest mass quarantine in all of human history. So, they're really, and Australia is having people who are repatriated to the country coming from China undergo, at least this is their plan, to undergo I think a 2-week period of time on Christmas Island in quarantine, and the United States government is planning to quarantine people returning from China. They've just evacuated, I think it was last night, maybe it was the night before. They just recently evacuated a plane load of Americans from Wuhan, and they're quarantining them for a week. And so, the governments around the world are taking precautions. Individuals are taking precautions. It's still said that your best ways of preventing contracting the illness are to wash your hands frequently, avoid touching your face. If you haven't yet washed your hands when you've been outside, of course, once you're in your house, you're not going to take these extreme measures, but wearing a mask and glasses or goggles can help as well. The masks they suggest are, I think they're called 95N, that will filter out viruses. And in fact, the face masks in places where you find cases of the illness are selling out really quickly, and in other places sometimes as well. So these are things to keep in mind. They say that you shouldn't worry yet, particularly if you live in a place where you haven't seen any cases. But even when things get bad, the best thing to do is to follow best practices in terms of prevention that you can. If you were in Wuhan, or if in the future things get really bad, you aren't going to want to leave your house without glasses or goggles, really good face mask, and say gloves. You're going to want to wash your hands really well when you get back, use hand sanitizers, that sort of thing. And hopefully this will all blow over quickly and with as little bad impact as possible. So I, again, thank you so much for joining me here at Home with Melissa for today's update and the updated statistics in regard to the novel coronavirus. I hope to get back to, hopefully quickly, hopefully this will pass, or I'll have some time in addition to it and the ability to do some of my normal kind of videos soon, which are basically demonstrations and things pertaining to animals and home and things like that. You can check out some of my other videos if you want to see what kind of thing I usually do. And hopefully this won't last long for everybody's sake. So basically check in with me again if you'd like to see my future updates, because I probably will be doing quite a bit. If you subscribe, you can click on the bell next to where you hit subscribe, and then you'll get notifications that tell you when I've updated uploaded another video. So, if you're interested in that, go ahead. And I hope that you have a really great day. Stay safe and take care of yourself. And I hope to talk to you again. Thanks. Bye.